Okay, good afternoon, everybody, and I want to welcome you to Top Education's presentation, Is Dry Needling Right for Your Practice? We are honored to have Dr. David Fishkin, an authority in the field of dry needling, to present a short information video for you to decide if dry needling is appropriate for your patients and your practice. As always, we will have the recording of this video on and available for all to view after today. So I'd like to not waste any more time and introduce Dr. David Fishkin, and he can talk a little bit about himself and dry needling. Dr. Fishkin, it's all yours.
Thank you, Mark, and good afternoon to everybody. Thank you for signing on and listening to this presentation. Let me just give you a little bit of background about myself. I'm a practicing chiropractor for over 31 years, as you can see on the screen. I live in Maryland, and all of my academic background is there. I've been practicing dry needling since about 1998. And I fell into it really by accident. I was working with an anesthesiologist who was helping to treat patients with trigger injections. And he noted that the patients would respond very quickly between the injection and or what we were doing manually from a chiropractic perspective. And they really responded, he said, too fast for the drug to really have any effect. And he said that the needle was really, really accounting for that. When he said that, that really rung a bell in my head. And I did some research and I found a paper from 1979 by a Czech physician that some of you may know named Karel Lewitt, who actually found that this was the case. And it was from then that I started initially using injection needles, which are not good to use because they can cause scar formation, and the patient can't tolerate too much of that. We later then switched to the solid filiform needle, which is the same type of needle that is used by the acupuncturist. And let's start there. First of all, what is dry needling? Some people confuse it with acupuncture, or they think it's like acupuncture, or it's Western acupuncture, and it's really not acupuncture at all. And it's a very important point to really make clear to everybody from both a technical and from a legal aspect, because acupuncturists will be upset or are upset by this, and we need to distinguish that. The acupuncture needle is a FDA Class 2 medical device, which everyone is permitted to use. The term acupuncture needle is merely an FDA marketing statement, which they have to do. So you're all entitled to use the said acupuncture needle, but you should refer to it as a solid filiform needle. Now, this needle is a supportive procedure to all chiropractic techniques. It really is the kind of technique that you want to use prior to all other manual techniques, and I'll get into that a little bit more. You all understand the concept of spinal manipulation or the adjustment, and what we're doing with that is we're taking hypomobile synovial joint segments and we're improving them or maximizing their ability. The dry needling is doing the exact same thing on a soft tissue basis. That is, we're taking a thin needle and we're penetrating into the soft tissue to essentially break the lock. The tissue becomes locked just like the synovial joint does. But we're using many other techniques out there, ultrasound and ART and laser and all these other things. But there's really something unique about using a very thin needle that's penetrating deep into the tissue that breaks that soft tissue lock, unlike many of the other techniques. So that's a reason to consider using this, because it has many advantages in terms of how it affects the tissue, to what degree it affects the tissue. For example, if you're treating a patient who's a 250-pound person, which is not that uncommon today, and they have a major lumbar issue or a pelvic issue or a gluteal issue, then it's really difficult to penetrate. Even with laser, it does not go quite that deep, and that gets dissipated as it is going deeper. the dry needling technique is a way to get deeper into that tissue and to break that soft tissue hypermobility or that soft tissue fixation. So what I always say is that the dry needling technique on the soft tissue side is the closest approximation to the chiropractic manipulation in terms of what it's accomplishing. And as I said, we can reach tissue depth with effectiveness that really we can't achieve with any other soft tissue technique. And when you use this technique, it's going to be a great thumb saver or even a tool saver, because even when you're using a tool, you still have to use a lot of manual pressure with your own hands to accomplish that. But even with all of those modalities, nothing really will go as deep as dry needling. So I always find clinically, I've been doing this since 1998, that when we do disrupt the soft tissue lock, it always improves the effectiveness of chiropractic outcomes. If you accept the premise that the soft tissue system is much larger than the synovial system, and that if it's in a lock state, it's going to restrict the ability of you to release the synovial system, and therefore by releasing the soft tissue system first, it will allow the chiropractic manipulation to proceed much more easily, much more comfortably, and will last longer. So what will you accomplish by adding dry needling to your practice? You are going to get a quicker stabilization of the patient's acute pain, and I'll give you a little example of that, and management of chronic pain. In terms of the acute pain, when patients come into my office in an antalgic form, for example, where they have a serious Miner's sign and they can't ambulate very well, we will do a extended procedure to get them more stable. And usually within that extended procedure, which is 3 rounds of dry needling, that patient will improve dramatically to the point that they can ambulate better, and we can get them to stabilization phase much faster. In terms of the management of chronic issues, for example, we have opioid issues and people who are just taking medication, ad nauseum, and we can help to downgrade their need for those medications and also help them be more comfortable for the long haul. And they do very well on the chronic management side. And it is a comfortable technique. There are differences, which we'll talk a little bit more about in a few minutes, regarding the types of dry needling. It's not a monolithic. There are differences, and that's an important thing to know. If you're going to start looking at different types of approaches that people do with dry needling, and I'll explain some of the differences between what I teach and practice and what's being done out in the field. Now, if you're doing a lot of manual therapy techniques that require time and a lot of energy, this technique will allow you to be able to deliver your manual therapy techniques in a shorter amount of time. If you do the dry needling prior to any of the other techniques, it's just going to make those other things go quicker, and you'll have decreased time that you'll have to be spending doing it. And it will, in fact, allow you to see more patients if you want to. If you just want to stay with the patient volume that you have and just be more comfortable and have more energy and less pain in your own body, then you can also do it that way. For the very complex cases, especially in cases where you may not be able to necessarily do all the manipulation techniques that you want for various reasons, this is a great way to manage those patients. It's also a great way to manage patients who may not enjoy manipulation. They may have a phobia about it. So it's another tool in your toolbox and a way to keep your patients under your care, but without having to send them out to others. And by the way, this is something that patients seek out. They call, they ask for it. The primary doctors are very comfortable with dry needling. It speaks to to their minds, and they're very happy to refer patients for dry needling. In those cases where some physicians are a little bit hesitant with manipulation because they have preconceived notions, they may be more amenable to the dry needling. And many professional sports teams, in fact, I had trained several PTs who were working for the professional basketball teams in your town, and it's being used heavily by all of the National Football League. So, those people are looking for solutions to problems, and they really benefit from it. And the military is making use of dry needling. I've trained a number of military, both PTs and chiros, who are using it in the military, and they're even using it in the front lines, in the military active duty areas. Anyone who you treat who needs a high level of readiness and physical performance should be under care with dry needling. This will help to keep their soft tissue system in a peak performance level, and that also gives you a clinical reason to have them be coming in to find these issues before they put these folks into a problem and that they can't perform. So, of course, this is another service that you'll be providing, and whether it's insurance or non-insurance, it is another service that people are happy to pay for, and we've seen that over and over again. So, with regarding to payment, I'll tell you a few things about that. First of all, it depends the region in which you are practicing. The company, even within the company, the policies. So it is variable, because right now there's no dedicated code, but that's being worked on. And I'll tell you a little bit about that. Many workers' compensation commissions and equate dry needling with trigger injection, and they do cover. And in the PI world, it's covered as well. And the American Physical Therapy Association and the American Chiropractic Association have joined forces in developing a dedicated CPT code for this. Whether that will make things better, it may in fact make it better. But right now, some people just treat it as an uncovered service. And for those who are in cash practices, of course, that's not an issue. And this could be an add-on service if you are a heavy insurance type of practice. And patients will spend their own money to get effective treatment, and they seem to be very happy paying extra to get this. And as I said, high-level people, athletes, and not just professional, but college and the high school athletes I've treated benefit from this as well, of course. And patients are looking for alternatives to pharmacology. As you all know, there's an opioid crisis out there, and doctors are under great stress to prescribe less, and therefore people are actively looking for more other ways. By the way, the FDA, if you don't know, the FDA cites both chiropractic and needling techniques as alternative ways to deal with pain, and JACO, which is the hospital, which covers hospitals, also recognizes chiropractic and needling techniques. So I mentioned earlier that there are differences in training. What we see, what I've seen, is there are two major models. One is largely been promoted by the PT profession based on a very maybe two studies, one animal study and one small human study, where they found that inserting the needle in a particular way causes a particular reaction. There's something called the local twitch response, which is what they concluded is the event that causes the change or the positive change. That really in practice is incorrect, and the way that they go about it is extremely uncomfortable. When a patient comes into your practice in pain, they're already in a sympathetic, upregulated state. What happens with the technique that they're teaching is that they continue to upregulate the patient. So you may be able to get away with this type of approach on a very short-term basis. But certainly if someone is needing follow-up care, and this is the case with chronic patients, they need to come back on a some more frequent basis. They're not going to be able to tolerate that. Or you take someone who's a heavy weightlifter or in the gym a lot, and they also cannot tolerate it week in and week out. So the weightlifters and the intense trainers come in with the technique that I use and teach, which is much more comfortable. They can tolerate it and they're very happy. In fact, this technique that I teach down-regulates the sympathetic system, and the patients often just relax and many fall asleep. So it's a very good technique. So if the experience is upregulating them, that's going to deter follow-up care. In what I'm teaching, because of how I teach it, we can treat areas that the other technique cannot conceivably treat. For example, in the thoracic spine, you have to be very careful because if you don't know what you're doing, you can cause an pneumothorax. In the technique that these others are teaching, they really don't teach the thoracic at all, because that technique is going to violate the pleural cavity. And there are many conditions which require treatment of the thoracic region. So, contusions, fractures, intercostal neuritis, costochondritis, all of these things I see on a very, very regular basis. And with this technique, you can treat those things very safely without any issue. So that is what we're focused on: two things: safety for the patient and safety for the doctor. In terms of safety for the patient, learning the technique, doing it properly is key. Safety for you is the training. Training protects you from a liability point of view. We give you, forms, informed consent to make sure that you are protected. Also, how is the teaching being done is very important. That is the quality of teaching regarding teacher to student ratio, and also implementation. How are you going to integrate this into your practice? You all have your own ways of practicing. And sometimes those things are difficult to change. Some people have more difficulty than others. So I go through how you can integrate this into your practice slowly without disrupting your entire practice life. And this is a comprehensive course. Many other courses you have to go to 2 and 3 courses to get what I give you in a weekend. That's because of my years of doing it. I'm one of the longest teaching people out there. My approach is very efficient. It's very comprehensive. We cover head to toe, and we cover all areas, and we get it done in one weekend. That saves you a lot of time and money. Because I'm a full-time practicing doctor. I'm not in the business of just selling courses. So when you complete the weekend training, you are competent to treat Monday morning. I've trained over 650 doctors, not just chiropractors, but all kinds. This course is open to anyone who under their license can use a needle, which is not true in all states. So I want to say that, first of all, you're very lucky in Massachusetts to be able to do this now. I've been hoping that this would happen in your state for a long time. And so I'm glad that you'll have the opportunity, because it's a wonderful technique. So you will be getting a very nice weekend. This is not going to be in some small cramped room. We're going to be in a nice facility. We're going to be, getting, food. It's very enjoyable. Most doctors say this is, the best experience they've had since their basic training. It's a lot of fun, and you're going to learn a skill that you can implement right away, which will help people. It will decrease the stress on you, and will improve your bottom line. Also, you'll be getting your certificate and 12 CEUs through University of Western States. You get a full starter kit so that you can hit the ground running on your next day in clinic. You get a training manual as a reference manual, and a flash drive that's just packed with papers, research, and also all of your doc-ready forms and policies. So all you have to do is put your clinic name on it. So I've really tried to make this as turnkey as possible, and to also really run a classy course that's in it that where you're treated like doctors and treated well. So I hope that you will consider getting trained. It will benefit you, your patients, and your families. If you have any questions, I'm happy to field any of that. And also, you can register by calling the office directly. My assistant will take down your information. It's April 6th and 7th, Saturday, Sunday, and in Marlborough, Mass.
Okay, thank you very much, Dr. Fishkin. That was excellent. A nice overview of what dry needling is all about and what it can do for us in our practices. So if anybody has any specific questions for Dr. Fishkin, he would be happy to answer them. In the meantime, let me just review that you register simply by calling his office, and he will be able to take care of everything from there. Okay. So is there any advances in letting OTs use this? Well, I can even answer that in a sense, and then Dr. Fishkin can jump in if he wants. Everything's state regulated. So when it comes to whether or not somebody can or cannot do a procedure, it all has to do with your state board. So you'd have to go to your allied health board and see if that's something that's allowed. By your particular specialty. I know the physical therapists in Massachusetts do have it on their law, but have not yet drafted their regulations. So it could be something that's in the process.
Yes, and that's exactly right, Mark. And I've trained a number of OTs over time from different states, and it is totally state dependent.
Yeah. We have another question that says, at my clinic, the PTs do the needling for me. I am collecting data in attempt to change our practice act. So could you let me know what state you're talking about? The one who wrote that question. Yeah, we don't know.
OTs?
It's just one doctor saying that they're trying to change their practicing act, or OTs. So it does require, it doesn't necessarily require a change in your law. So here in Massachusetts, the way we got it around, it was you just interpret your law and decide whether you have a law that includes what you can do or excludes what you can't do. It all has to do with the language of your law. But we didn't change our law. It was an interpretation of our law by our current board. So these things can happen overnight, actually. Thank you. That was in May.
In the case of OTs, they usually have something called physical agent modalities.
Right.
And as long as the state regulation, state law doesn't prohibit penetration of the skin, then it's quite possible that that you'll be able to do it. But for the OTs, they need to work with their association on that.
Right. This was a question specific to Maine, and the truth is, this is a manual therapy technique, or it is a soft tissue technique, and it mimics the same reasons why you would do manual therapy. So OT, PT, DC, MD, whatever, DO, the reasons why you do it are common to all of us. The conditions that we treat are common to all of us. So what you have to do is like Dr. Fishkin said, see if there's anything in your law that tells you specifically that you can't do it. And if it doesn't, then it falls within the scope of your practice, most likely, because it is not acupuncture, which is a whole other separate discipline.
And the issues, by the way, are often not about the law, but they become political. So you have to differentiate between what appears to be allowable under the law, and then dealing with any particular board and their politics, and that's where it gets sometimes can get dicey.
Great, you're welcome, Mariah. It was a pleasure. Any other questions for Dr. Fishkin at this point? So please consider registering. The class will be April 6 and 7. It is limited registration because, like he said, you can only teach so many people effectively. So call his office. They'll give you the details. And if you have any questions, you can contact me also at learn@toolsofpractice.com. Oh, we do have a question here, Dr. Fishkin. How long does a treatment last?
On average, 10 to 15 minutes. So when you schedule patients for other passive modalities, let's say you're using a stim in one area of their body, you can needle them in a different area of their body, and you're basically treating two areas with two different modalities at the same time.
What about the effective time? How long does the relief last?
Well, of course, it all depends on the patient and the case, if they're acute or chronic. But I can tell you from doing this a long time that we get incredibly responsive results. For example, in the acute case that I described earlier, that patient came in. He had to get on a plane that evening, and he could literally not sit on his right glute. That's how much pain he was in. And I examined him, and I found what was positive on him. I laid him lateral recumbent on the table. And you don't need a chiro table. You can just use a massage table. Is actually quite good for a lot of these techniques. I treated him twice, and that was a longer session because he was acute. He was able to get off of the table and walk and sit. So that's how quick it can come about. Now, of course, there are cases that won't be that quick if they're chronic. Then they take time to come under to become stable and to reach a certain equilibrium. So then you can start to lengthen out their treatment time.
Yeah, I guess similar to a chiropractic adjustment, right? We get our miracles, and we also get.
Yes, yeah, but I will tell you the rate of miracles that I see,
Yeah.
as many miracles as you all get, right? Everyone does have incredible, cases. I see them much more frequently using this technique in my practice.
Okay, we do have one more question. This will be our last question. Do you teach the use of e-stim with needling? So do you use electrical
So,
needling?
yeah, so I know that that's become somewhat of a fad, but if you, when I go into greater detail about the underlying theories, if you start adding e-stim, you start to upregulate the whole system. And a lot of patients don't like it, and it's really unnecessary. So if you're going to end up upregulating the sympathetic system by doing that, it's counterproductive. And I find I rarely ever have to do that. I have the ability to do it, but adding alligator clips and current it doesn't really take all that much. That's just a very small piece. But I do not emphasize that. I really emphasize people not to use e-stim because it's really unnecessary, and I think it's counterproductive in many cases.
All right, good. Well, I want to thank you, Dr. Fishkin, for taking the time to instruct us. I know way more about dry needling now than I did a half an hour ago. So thank you. And
Great.
please, if anybody is, if you want to flash the number back one more time, if you're interested in joining us in April 6th and 7th, please call 301-444-4890. And I hope you have a nice day. Thank you, Dr. Fishkin.
Thank you for inviting me. I appreciate that. Thank you.